There are so many wonderful attributes of part of being a system. We have our challenges, just like everybody else does, but because we are a fully integrated system, that allows us to provide world-class care to rural communities. So the opportunity to be able to go into communities that are a few hundred people, a few thousand people, or even some of our larger communities, it really allows us to knit together all of our resources to be able to meet those needs. And so it's everything from doing physician outreach, where our physicians are traveling hundreds of miles to extend care, or leveraging our virtual capabilities and being able to, through digital connection, come into these communities to bring specialists and subspecialists partnered up with maybe one of their advanced practice providers, one of our primary care physicians, to make sure that they don't go without. We know that healthcare is best delivered when it's delivered locally. When the people who are in charge of the delivery of that healthcare live in those communities, they know those communities, and so for us, it's always a delicate balancing act. How do we drive all the value and all the synergies of being a system? Making sure that we standardize where we can and where it makes sense. How do we maximize the dollar and ensure that we're the best possible steward of that? How do we ensure that every, one of the hospitals we have the privilege of serving at, whether it's a small critical access or whether it's a level 1 trauma center, to make sure that they have access to the best tier of technology, but also at the same time making sure that we have local leaders in those communities who are really the face of Sanford Health. We do think it's extremely important that as many decisions as possible are made locally and that they're led locally.